I'm Shakara Harris.
I'm Madelaine Johnston.
And I'm Ashley Vasquez.
Practice without theory is blind, and theory without practice is sterile. DeBovie et al. 2015. By integrating virtual reality into nursing, students are immersed in an experience that allows them to practice real-world scenarios safely and effectively. Traditional teaching methods, such as formal lectures and Socrative discussions, are the standard for nursing education, but they do not leave nursing students fully equipped with critical thinking and decision-making skills that are necessary in high-pressure situations. Our methodology is databases included Baylor Library OneSearch, Google Scholar, PubMed, and NIH were utilized during the article search process. The research team included keywords such as virtual reality, nursing student, nursing education, qualitative study, quantitative study, and nursing school. Filters used by the teams included peer-reviewed studies and published within the last 10 years.
All of the articles selected by the research team demonstrated supporting evidence for the use of virtual reality simulation in the education of undergraduate nursing students. DeBovie et al. 2017 and Samersorn et al. 2020 both conducted quasi-experimental studies and found that VR simulation improved students' understanding during simulations and provided an accessible educational tool. Verkile et al. 2017 executed an RCT that revealed increased self-efficacy and confidence, a finding substantiated by the quasi-experimental study conducted by Saab et al. 2021. However, Ismailoglu and Zaybak found similar levels of confidence in both the control and VR groups. Ismailoglu and Zaybak 2018 studied VR IV catheter teaching through a quasi-experimental study and found higher satisfaction in psychomotor scores in the VR group compared to the control group. Saab et al. 2022 carried out a usability study, ultimately finding that students' perception of VR simulation to be informative and safe on page 815. Limitations identified by DeBovie et al. 2017, Samersorn et al. 2020, Saab et al. 2022, and Saab et al. 2021 include sampling bias, leading to results that are not generalizable. All studies indicated further research is needed to explore the long-term effects of VR on nursing student education. Applying the synthesis of findings to advance the nurse's role in health equity necessitates leveraging virtual reality's capabilities beyond basic education. Saab et al. 2021 highlighted that virtual reality could promote equity among students by delivering the same information through the same medium, especially when exposure to certain clinical experiences is limited and intermittent. Building on this, virtual reality can simulate scenarios where nurses must navigate resource limitations or challenge biases within the healthcare system that contribute to disparities. For instance, a simulation could involve escalation of care, Saab et al. 2022, page 4, in an under-resourced setting, requiring nurses to advocate for their patients' needs effectively.
Particular studies show significant findings in favor of VR over traditional methods, such as the increase in airway management knowledge post-test with a faculty increase of 45% and a student increase of 100%, as cited in Samersorn et al. 2019. The majority of the team studies show that while VR can be extremely beneficial to factors such as self-efficacy, reducing anxiety, and providing a safe environment for trial and error, it cannot stand on its own as a learning tool. The combination of both traditional methods and virtual reality complement each other in a way that is most beneficial to the nursing student. Our references are listed below.